Hello, it is Hera and welcome to Healthy and Happy with Hera to discover the bright side of life. Today we will focus on a major breakthrough that was announced on 16th June for patients with COVID-19 and its treatment. In addition, we will learn the latest news regarding the COVID-19 vaccine and when it is expected to be available. Furthermore, we will talk about everything that you need to know regarding face masks and covering. For the ones that do not know me, I am Hera, a healthcare professional, business manager in the well-being sector, and model and TV presenter. So, what is the breakthrough news? Dexamethasone, an anti-inflammatory drug, which is part of the recovery trial. It is the first drug that has been proven to reduce deaths in up to 1/3 of hospitalized patients with severe respiratory complications and will already be used as a treatment in the UK. Funded by the UK government, the Oxford University UK Recovery Trial is the first clinical trial anywhere in the world to show a treatment provides significant impact in reducing patients' mortality. The National Clinical Trial Recovery aims to identify treatments that may be beneficial for people with COVID-19. More treatments are being tested by the recovery trial, so there could be other potential successful treatments too.
And the key question we all are asking is how do we best treat these patients, make sure that they recover quickly. Now there are a number of drugs that are being suggested to be used in these patients, but we really don't know if they're effective or not. There are some people that would argue, well, let's just give them anyway. But then we really don't know if we're giving the best care, and we need to get the evidence so that we can move forward with confidence. The best way to do that is in a clinical trial. So we're keeping the trial to be as flexible as possible. At the moment we have a number of drugs that have been recommended for evaluation by expert committees, and they're the ones that we are prioritising. But new evidence will emerge over the coming weeks and months, and also perhaps even new drugs. So we have the option to add these new drugs into the trial when they become available.
Now that you know more about possible treatments, are you wondering what are the latest news regarding COVID-19 vaccines and when would they be available for the public? The Oxford Vaccine Centre's COVID-19 started work on developing a vaccine to prevent COVID-19 on 20th January 2020. The clinical trial is being conducted in collaboration with multiple study sites across the UK and is being developed in a record time. The exciting news is that their researchers have begun recruiting for the next phase of the trial already, recruiting human volunteers. In the first phase, more than 1,000 immunizations have been completed. The phase 2-3 part of the study, which is starting, will enroll up to 10,260 adults, including a small number of older adults and children. Other late-stage trials are also due to begin in a number of countries in the world. Another important information is that AstraZeneca has reached an agreement with Europe's Inclusive Vaccine Alliance to supply up to 400 million doses of University of Oxford's COVID-19 vaccine, with delivery starting by the end of 2020. So this is very positive news. As part of the agreement, AstraZeneca continues to build a number of supply chains across the world, including Europe, in order to meet the commitment to support access to the vaccine at no profit during the pandemic. The total manufacturing capacity currently stands at 2 billion doses, which is amazing how quickly they have managed to do everything. Another important thing to remember is that scientists are working against the time to test the vaccine. Because the number of UK coronavirus cases is dropping every day, there may not be enough evidence, according to the Institute's director, Professor Adrian Hill. He highlighted that while there was an 80% chance of developing an effective vaccine by September, at the moment there's a 50% chance that we get no result at all from this trial. Now, I want us to talk about another important topic regarding face masks or coverings and answer the questions you may have, because more and more people are using them and it's important to know to use them in the right way.
What you will need, it will be a piece of cloth. In my case, I'm using this bandana, and you will need 2 hairbands, and that is it. Now, you take your square bit of fabric, lay it flat, fold it in the middle, and then you take one edge, bring it into the center, and the other edge, bring it into the center. Take one hairband, slide it in for about 6 inches, and do the same with the other side. Then you fold the fabric where the hairbands are into the center until they touch each other. And there you go. That is your face covering. Make sure you handle it from your hairbands and that it covers from above your nose till under your chin. I'll show you. Really easy and quick. Thanks very much everyone for watching. I hope you stay safe.
What you should know is that non-medical or cloth face masks are only effective when used alongside with preventative measures, such as social distancing. In addition, remember that you should wash your hands or use hand sanitizer before putting your face covering and after taking it off, avoiding touching the front of it. It is important that people don't touch their face covering when wearing it to avoid hand-to-mask transmission of the virus. So I know that it's a bit difficult because many times we touch our face without even realizing it, and especially if you want to drink something, etc. So it would be very challenging. So when should you wear face covering? You must wear a face covering at all times on public transport or when attending a hospital and in other enclosed public spaces where social distancing isn't possible and where you will come into contact with people you do not normally meet. Evidence suggests that wearing a face covering does not protect you. However, if you are infected and have not yet developed symptoms, it may provide some protections for others you come into close contact with. So the face coverings like this do not replace social distancing and are not the same as the surgical masks or respirators used by healthcare and other workers as part of personal protective equipment. It is important to use face coverings properly. The key thing is that it should cover both the mouth and nose, otherwise it will not be effective.
A fabric mask acts as a barrier to prevent the spread of the virus. It must be used correctly and always combined with other measures to protect yourself and everyone else. When wearing a fabric mask, clean your hands before putting it on. Inspect the mask and do not use it if it is damaged or dirty. Cover your mouth, nose and chin. Adjust the mask to your face, leaving no gaps on the sides. Avoid touching the mask while wearing it. Change your mask once it gets dirty or wet. To take off the mask, clean your hands first. Remove it by the straps behind the head or ears without touching the front of the mask. As you remove the mask, pull it away from your face. Clean your hands after taking off any mask. If you need to reuse a fabric mask, store it in a clean, resealable bag. Hold the mask at the elastic ends when removing it from the bag and make sure it is not dirty or wet before using it again. Wash fabric masks in soap or detergent, preferably with hot water, at least once a day. Make sure you have your own mask and do not share it with others.
So that's all for today. You can watch Health and Happy with Hera on TV, but also at Albi UK social media. Don't forget to subscribe at YouTube at Health and Happy with Hera, where you will find all episodes with subtitles too. Let me know if you find this video helpful, and thank you so much for being today with me. See you again at the next episode next week. Take care. Bye.